My name's Quint Studer with the Studer Group. Each month, it's my great pleasure to award 2 awards, and these awards are for the Healthcare Organization of the Month. We offer one for a smaller hospital or a smaller system and one for a large system. It's a very difficult award to win. In fact, I've often said that at Studer Group here, we've coached many Malcolm Baldrige Award winners, and we've won the Malcolm Baldrige Award ourselves. Yet some of our organizations that we coach that have won the Malcolm Baldrige Award have actually never been named the Organization of the Month by the Studer Group. Now, it originally started with being called a Firestarter Organization of the Month, an organization that really ignites the flame and keeps it going. And what I mean keeps it going, it means creates great places for employees to work, physicians to practice medicine, and patients to receive care. What happens with this award is you get a nice crystal flame. It's something that you can use in your organization and keep forever. I think it provides great community publicity. Some of the organizations have really got wonderful stories and articles about this award and why they've accomplished it and so on. It's also a wonderful award to recognize with the board of directors, the medical staff, and certainly in the organization with the employees, because to combine with the board, the volunteers, the medical staff, and the employees really is what earns this award. Now, at Crete Medical Center, there's no doubt that you should be the March Organization of the Month Award, and this will be in the mail as soon as I finish this video to go to you. It's really quite remarkable. In fact, getting to do this every month and we look at hundreds of organizations that might be eligible, it's sort of evident when there's somebody out there that just pops to the screen. In fact, if you didn't get it, I think you should really have protested, but thankfully we'll save you a protest by giving you this award because they're certainly deserved. In the area of patient care or patient perception of care, your overall rating, which means the amount of people that give you a 9 and 10 versus other numbers on a 10-point scale, has gone from the 63rd percentile to the 92nd percentile. That meant you went from being the top 40% of healthcare providers to being the top 8% of healthcare providers. In nurse communication, you went from the 34th percentile to the 83rd percentile. Now, when you look at nurse communication, of course, that brings in a lot of other factors, such as communication of medications, which you went from the 28th percentile to the 90th percentile, and also pain management. You went from the 33rd percentile to the 96th percentile. Can you imagine? That means when a patient is in your organization, you manage pain in the top 4% of all healthcare organizations in the United States of America. What I love about HCAHPS is the fact that you can compare yourself to all organizations across the country. We work with some very well-known big flagship organizations that you all read about in magazines and papers because of their size, but fortunately we work with 125 organizations that are considered small. This is one of those areas when a patient's in a room, they don't say, well, gee, my pain's being managed for a small place versus a middle-sized place to a large place. They just have one thing, is my pain being managed? Do I understand side effects of communication? Is nurse communication responsive to me? Do they listen and answer my questions? And is the overall rating of care good, which includes things like doctor communication, noise, understanding discharge planning, and so on. So congratulations. Just absolutely a remarkable achievement. It certainly shows today that your organization is certainly living the mission even to a more full extent than it was in 2008 when you were ranked the 63rd, the 34th, the 28th, and the 33. Compare that to 92, 83, 90, and 96. How amazing. Of course, one of the things you've absolutely done is create a better place for people to work. You've reduced your overall RN turnover from 56% in 2008 to 8% in 2011. Now, let me explain what that means from a clinical perspective. According to research by the Voluntary Hospital Association, when organizations get their turnover below the 12th percentile, what that means is better clinical outcomes. That means more people live than that could have died. It means there's better handoffs, there's less litigation, less lawsuits, but most importantly, there's better clinical outcomes. You've improved your employee engagement from 45th percentile in 2008 to the 91st percentile in 2011. The University of Alabama Birmingham just completed a study. Actually, it was about a year ago they completed a study which they show that employee engagement has a direct correlation to patient safety. An engaged employee will take better care of people. An engaged employee, even if they don't touch patients, will do a better job supporting those that do touch patients. An engaged workforce is better at process improvement. Because if I'm engaged, I feel like an owner. And if I feel like an owner, what that means then is I will not just work around, I will make process improvement. So it's really quite amazing what you've done. So on behalf of the Studer Group, we'd like to congratulate Crete Area Medical Center, Crete, Nebraska. You're our March 2012 Healthcare Organization of the Month in the small category. Now, what this also means is we look forward to seeing you in October. In October at our national conference in Nashville, we honor all our organizations that were honored with this award as Healthcare Organization of the Month. So it's going to be fun to see Carol, you and your team there as we once again honor your organization. You'll also be on our website. Starting March, you'll be listed on our website. Now, we have over 100,000 people that come to our website. What that means is when organizations are looking for ways to improve, they're going to read about Crete Area Medical Center. So you're not only helping people in Nebraska, you're going to be helping people all over the world. Thank you for being a great example of what a great healthcare organization can be and is, because you're certainly doing it. My congratulations.